Hi, doctor. I get asked a lot, when should you order a CRMA? When should you order an excessive motion study to determine how badly damaged the non-disc ligaments are? Well, my question is always right back to the doctor, how soon do you want to know how damaged the spine is? So in order to assess spinal injuries, you have to understand that the most significant injury you're going to have there, and the most amount of ligaments there are the spinal support ligaments, the non-disc ligaments. There's a heck of a lot more non-disc ligaments than there are disc ligaments. So you want to, if you think you have a sprain is a ligament injury, then you want to assess. Anybody that you think has ligament damage to the spine, you're going to want to order an excessive motion study on. Now, when you don't order an excessive motion study, you're telling the whole world that you don't think there's ligament damage. Just like if you don't order an MRI, you're telling the whole world that you don't think there's a disc herniation. Okay, which is fine. If you don't think they're there, you wouldn't order the study. But if you think that there is ligament damage, and remember, there's only two ways to damage the spine. There's only two tissues involved with the spine: bone and connective tissue. The connective tissue is called ligaments. You already know that, right? So if you don't think you have a fracture, and you don't think you have a ligament injury, then you don't have a spinal injury. There is no other spinal injuries that there are. Right? So of course you're going to order an excessive motion study. When are you going to order it? You're going to order it early, in the beginning. When does a patient, if you wanted to know how badly damaged the shoulder is, when do you want to know how badly damaged the shoulder is? Do you want to know it 6 weeks from now? Do you want to know it 6 months from now? You want to put the patient under care and then figure it out 6 months later? No. You want to know immediately. Now, what's the only key to excessive motion testing with a patient? They have to be able to get in position. That's it. You can test the day of the accident, the next day, as long as they can get in position. And the majority of patients can get in position. They can do full flexion and full extension. When I say full flexion and full extension, that's good enough to do an excessive motion study. They can do the A to P open mouth, lateral bends. They can flex and extend their lumbar spine. If they can't, then of course you want to do some treatment, document that they can't, do some treatment, reduce the inflammation. 2 weeks later, 4 weeks later, whatever it is, you take the excessive motion study, documenting exactly what you're doing, telling the whole world why you're waiting, what you're waiting for, what you're looking to get from the test, and then you test. And then you put the patient in position, and then you test. But you want to do it as early as possible. Now, there's some doctors out there and even some trainers out there that say, oh, no, this is just for impairment rating. Oh my God, nothing could be further from the truth. Yes, impairment rating, impairment is an injury, and it's a permanent injury. And the impairment is something that the impairment guides give you as basically objective validation as to what is the future aspect of the patient with this injury. In other words, it validates like what is the patient going to experience as a result of these injuries on a more probable than not basis. So it's very important, but you want to do the excessive motion test as soon as you possibly can, because it's going to dictate everything you do. It's going to dictate what kind of care, how long is the care, what kind of home care, what kind of in-office care. Am I going to use a soft wave? Am I going to use a laser? Am I going to use an ultrasound? What am I actually doing? Am I using massage? Am I doing home care? What am I doing? If I'm doing active stretching, passive stretching, all the various things that you might be doing in your office is going to be driven by the injuries themselves. So of course, you want to know as soon as possible how injured that patient is. And so, again, the key to CRMA and excessive motion testing is just, can the patient get in position? Can they flex their head forward? Can they flex their head back? Can they go to the side? Can they go to the side? And that's it. That's all there is to it. Shooting good x-rays is also very key, but we're going to assume that you already are very good, especially with today's modern technology with x-ray machines. We're already going to assume that you're very good with shooting x-rays. And so it's all pretty basic and pretty simple, but you don't want to wait. Now, let me tell you the case. Here's the case scenario. Here's what a bad doctor does. And if you've done this before, everything I'm saying a bad doctor does, I've done myself, right? But once I understood it was not right, I didn't do it again. So here's what a bad doctor does. They wait for 6 months to do a flexion extension study because they think it's some sort of an impairment rating tool. So they do it 6 months from now. Okay, person's under care for 6 months. 6 months later, they find out they have 2 levels of surgical damage. The amount of damage to the excessive motion, to the non-disc ligaments, say C2, C3, C4, is surgical. In other words, it's that much excessive motion, it qualifies for surgical guidelines for pre-authorization of spinal fusion surgery. And they find this out 6 months later. As a defense attorney, I am definitely going to look at the fact that you caused that. I'm going to look at the fact that your care caused that. And that's what I'm going to be asserting. And how do you contest it? You really can't. So you want to analyze the patient's injuries right away, as soon as you possibly can. Don't let the analysis of the injury get in the way. Don't let the fact that you have to send out for a test get in the way. And you want to send out. The results of a CRMA are so important. In my private practice, when I was practicing, I always wanted it done by an unbiased, independent group, if I could find one. Because the results are so important, they drive everything. I don't want somebody looking at it like it's biased. And today, doctors, if you're doing your own studies, trust me, they are biased. They're being looked upon as biased. There are offices all over the country, they're buying these softwares, and they have their front desk doing the actual testing. Like, I would definitely, in a insurance company defense attorney, I would definitely ask, are you the only one in the office doing these? Has anyone ever done these for you? Has anyone in your office done these? Do you have an unlicensed person that are doing these? These are all the questions that can get asked, right? And I would not want to be in that deposition. So doctors, having an unbiased test done by board-certified medical radiologists protects you. It always has, it always will. It protects you. So that's why you want to do it, and you want to do it early on. So hopefully I've made my point today. I just want you to understand that it's important to understand how injured your patient really is, right as close to you can at the beginning of care.